So now that the housekeeping is done, we're ready to start today's session with Dr. Julie Durnan of Ginger Desk. So, Dr. Julie, welcome. We are so thrilled that you are joining us today to share the tips that the Ginger Desk team has for optimizing practice admin workflows.
Thank you,
Um,
Dustin. And hi,
it's
Jane
so
community. So great to be here.
And so I wanted to give everyone in today's session a little context as to why we wanted to invite the Ginger Desk team to present on this particular topic. So the Ginger Desk team has so much real world experience helping Jane clinics do exactly this, optimize their admin workflows. Everything that Dr. Julie is going to share today has been tried and tested with real clinics using Jane that the Ginger Desk team works with. So it's like really just so accurate. It's from the clinics, it's from the people that you work with, it's from your peers. It's going to be so helpful. So first, before we jump into the session, Dr. Julie, I would just love to ask you to introduce yourself, tell us a bit about yourself and your journey and what brought you to where you are now.
Sure. Thank you, Dustin. Well, so thanks everyone for having me. It's such a pleasure. So my name is Dr. Julie Durnan, and I'm a naturopathic physician. I'm located in North Vancouver, BC in Canada. And I'm also the CEO and founder of Ginger Desk. And so the short version of what I was doing before I launched Ginger Desk is that I've been in practice now for 20 years. And before starting Ginger Desk, I had a busy and super thriving practice treating women and a lot of pediatrics. So I love treating women, children, and families. And I did that for almost 16 years before starting Ginger Desk in 2020. And along the way, I've also owned two integrative health clinics. I still own and operate one of them very actively, still today in North Vancouver with 9 naturopathic physicians. So all to say, I'm excited to speak with you, and I'm equipped to speak on clinic workflows, and I'm a little bit obsessed with them too. So thanks.
I love that so much. And I mean, I think you would have to be to start something like Ginger Desk. So I'd love for you to tell us a little bit more about Ginger Desk, the journey to where it came to be, and just so people understand like where this is coming from and why we invited you here today.
Awesome. So we're a team of virtual assistants. We're Canadian and we're located all across Canada. So we have a really big team now of 40 team members all across Canada. And we hire, train, and manage conventional medical office staff. And we teach them how to support health practitioners remotely. So I saw the need for this back in 2020 when my naturopathic colleagues all went online and started to do a lot of telemedicine. And I started to see the incredible demand that they had for quality medical assistance. And so I got to work, started a little pilot project right here in Canada, and it flew. So now today in 2024, we are all across Canada and the US supporting all kinds of practitioners from dozens of different health disciplines. And we do everything from like your day-to-day front desk support, like booking, billing, and communications by email and phone. But we also do optimizations in Jane. And we also do new account setups for new Jane customers. And we create office manuals too. We call them practice playbooks. And I'll talk a little bit about that later.
Amazing. So your team really are admin experts and definitely Jane admin experts, which is so great. So lastly, I just wanted to call out that you'll be covering a lot of Jane features in today's session, but we're not going to be going super in depth on how to set them up. We're more so going to be talking about how to and the why, to how to use them and the benefits that they can help to improve admin workflows. So I just want to make sure that I'm not getting anything wrong here. So that's what we're going to be doing today. But I also want to set everyone up for success in today's session. So this is going to be a little more high level of how these features work and how you can best use them. And then if after today's session, anyone is looking for more in-depth look into any of these features, we will include links to all of the relevant guides in the follow-up email. And you can also reach out to the Jane team directly to set up a call where we can walk you through anything you want to know more about. Because, as hopefully you already know, you have access to unlimited support with Jane, meaning you can call, email, and chat to us as often as you like. There is no limit. And our team is always more than happy to jump on a call to walk you through any questions you might have. And we also, as I mentioned, have members of the Jane team here in the chat and Q&A as well. So if you do have additional questions as the session is going on, we have some members of the team that can answer questions. And don't worry, I'll include all of this into the follow-up email as well, and it'll be in the recording as well. So with all of that admin done, I think the mic is yours, Dr. Julie, and I will be back at the end for the Q&A.
Excellent. Thank you, Dustin. So, our agenda for today is, and first of all, welcome. This is how to optimize your admin workflows. Our agenda for today is why optimize your systems in the first place. I'm going to talk about an admin health checkup checklist and how you can do this on your own, how you can also recruit support for it, but the top reasons why you need to really look at your admin and upgrade your admin department. And then we'll talk about how Ginger Desk can support you. And it's just a few slides on that. And then I have a very special surprise as well. So during registration for this webinar, we asked the Jane community if they had any questions on this topic of admin and workflows and saving time. And so throughout my presentation, we had loads of questions come in. And so instead of saving those for the Q&A at the end, what I thought I would do is just kind of weave them into my presentation. So I'm going to be getting to your most heated questions as I present. And for those of you here today who are attending live, we'll be opening things up for Q&A at the end. So please feel free to pop your questions in as we go, and I will get to them. So I've already introduced myself, but just a little bit about me. I graduated from the Boucher Institute of Naturopathic Medicine 18 years ago. That school's here in Canada. And I've been practicing now for 18 years since. So I'm so excited to be here today. And you know who we are at Ginger Desk. We have worked with hundreds and hundreds of practitioners. And aside from running their day-to-day virtual desks, we also build out playbooks, we do optimizations, and we do new account setups. So I'll speak a little bit more about that at the very end. So let's just dive right in. So why do an admin health checkup at all? And what is it? So there's a few key considerations, and these are really my take-home messages for today. I just wanted to get right into the meat of it. And first, for all you Swiftie fans out there, and even if you're not a Taylor Swift fan, but you're a practitioner, you're going to understand this meme. The tortured admin department is real. Practitioners are busy. I know you're busy, and we often don't have time to perfect our patient's journey through our practice. But patients expect speedy communication. They expect compassionate care and really great response times from your admin desk. And your admin desk is the front face of your entire business. So as health practitioners, I know firsthand that we suggest that patients see us for preventative health checkups. But when is the last time that you as a practitioner performed an admin health checkup on your own practice? So I know as an entrepreneur and as a business person, we always look at our finances. We look at our KPIs, our treatment programs, and our marketing. And we think that those are the biggest things that drive revenue in our business and success. But the poor, tortured admin department is often the one that's left out of our strategy sessions. Yet it's really the one driving and retaining your patients. So that's what I'm here today to talk about, is all the things that you need to really look at to create ultimate success in your workflows for your practice. So why should we be paying more attention to the health of our admin department? Using Jane to its full capacity will keep you highly organized and will maximize your practice potential in 3 key areas. So here are the 3 key areas: time, revenue, and the patient experience. So when you really focus in on how to optimize your admin workflows, you can use the automations in Jane and organize your systems really, really well, and they can save you time. So here at Ginger Desk, we found that people who really optimize Jane and their admin workflows can save 50 to 70 compared to those who don't. And that's time you can spend with your family, your friends, your fitness, your plants, your pets, and just generally finding joy and enjoying life. And revenue. Monitoring and improving efficiencies and optimizing your schedule will boost your revenue and improve your bottom line. And that's just plain and simple. So for those of you who are clinic owners like me, this goes double for if you have associates. If you're optimizing the schedules and the automations in Jane, you can really optimize your associate schedules and really drive retention and really boost revenue in that area. And the funny thing is about using automated features and creating seamless systems is that patients notice the great connection with your brand and your clinic when you do that. They don't necessarily need to be greeted by a human, but when they receive a notice that there's space on a wait list, or when they get a reminder to fill out an intake form, or an invoice is sent to them in a really automated way in a timely manner, it's all part of creating ease in their life and making your experience at your clinic more delightful. So this is all about creating a frictionless experience for your patients. And I'm going to walk you through some of the features you need to know about. And then um, the the patient experience. I mean, it's so important because patients want to feel seen and heard by your business. They want to know that you care. And like I said before, it doesn't matter if it was a human delivering that. They just want those touch points to be met along the way. So I'm going to talk to you about how you can show them you care with automated features. So here is what practitioners feel before they use the automated features in Jane, before they optimize their workflows. They say to us, my patients keep rescheduling their consults, and the back and forth in email and by phone is wasting so much time. We find that communications in the admin department take up 80% of an admin team member's time, or 80% of a practitioner's time spent in admin. And so if there's a possibility that we can automate that part, awesome. We hear that patients are tired of collecting payments. So collecting payments between consults takes me so much time. I have to space out my consults, or I have to pay my staff extra to handle that big load at the front desk. And often receivables are adding up for a lot of people that we talk to. And we hear probably the biggest pain point we hear from our Ginger Desk clients every day is that they spend so many of their evenings charting. So I'm going to show you some really simple features in Jane that can free up your charting by 50 to 75% and really just save you time, because that's what this is all about. So here's how your patients feel once you optimize your practice workflows. They say, this is so great. I can book and reschedule myself online. I don't have to wait for the clinic to be open. I can do this in my pajamas at any time of day or night. They say, I love the frictionless ease of payments. It's so nice to just pay online when I'm ready. I don't have to stand there at the front desk and wait for the front desk staff to be free. And they also love that when they see a really popular practitioner with a really long wait list, they love that they can just easily add themselves to the wait list and get notified right away when the practitioner is free. So all to say, amazing. Now, okay, here's what all of our clients love to screenshot. So this is the admin health checkup checklist. I'm going to go through this in detail, but I'm just warning you, if you are one for lists and checklists and you've got your phone handy or you know how to screenshot on your computer, please take a picture of this, because it's what everybody in our at Ginger Desk loves to snapshot. So save it for later. Consider where you're thriving, where maybe you might be lacking. Now, here it is. So take a picture if you like. These are really simple but powerful areas to consider. So for those of you who've used Jane for since the inception, you might know these areas, but chances are you're not optimizing them. So 80% of the clients that we see come through Ginger Desk who think that they know Jane really well, let's say they've used Jane for 5+ years and they're like, no, I'm good. We find that they're still not using 70% of the features that could optimize their workflows. So even if you think you're an expert, stay tuned. This is for you as well. If you're brand new to Jane, then that's great, because then you can get started and set these up optimally right from the get-go. So let's go. Now, the first one is foundational account settings. So this sounds a bit boring, I know, but it's actually the most important stuff, and that's why I put it as number one. So these are your account settings and defaults. And as Vanessa, who is the manager of our Ginger Systems department here at Ginger Desk, loves to say, it's like tweaking, it's like tweaking the tiny knobs in the background of Jane. So it's so critical to get these 15 settings correct right from the beginning, because they will make your whole life easier. So this is stuff like your online booking, your waitlist manager, etc. This is stuff like booking by treatment versus booking by practitioner, cutting off your online booking at 24 hours, etc. Now, the big thing I want to highlight is branding. So your brand is the whole face of your business, and it's so critical to get that right. And 80% of the clients that we see come to us for a Jane optimization or for an admin health checkup don't have the colors right, and they're not using the branding appropriately. So you want your colors, your logo, and to all mirror your website. So people don't often update their colors and their logo. And this is really mission critical for you in marketing. And you have a huge opportunity to build your brand here and to position yourself as a well-oiled branding machine. So what we see is that the most successful practices that we work with have this branding perfected. So just so you know, it does play a part, and your patients will respond when it's branded appropriately. So again, 80% of our clients that we see aren't using this properly. Now, there's one other hot tip that I wanted to mention here. It's a little bonus here. I speak with practitioners every day, all day, and I ask them very often, how many patients do you see per week? We need to know the volume of your practice so that we can best support your practice administratively. And 90% of practitioners that I speak to don't know. They don't know. They can look at their schedule for the day and they'll go, well, I just saw 15 patients today. But how many patients on average are you seeing per week? So there is a really easy way to tell this. And here it is. So you can go to settings, dashboard, and really quickly, you can actually filter by time period. And you can see how many patients that you've arrived per week or per month. And I really wanted to highlight this here today because it's so important for those of us building thriving businesses that we know our numbers. It will save you so much time. No more counting manually to figure out your KPIs. So use this. And next time we talk to you at Ginger Desk, I'm excited for you to know your numbers. Now, staff profiles. So you want to ensure that your photo, your bio, your billing numbers, and your designation are all listed here. This is also where you'll find the permissions, templates, and online booking settings. So this is really, really important to go in there and make sure that your staff, your associates, everybody has the right permissions. 90% of the practitioners that we work with have a photo and don't have a bio. And this is really important because people don't think about how it all fits together and it all serves their patients holistically. So hot tip is your online booking page is like a second website for you. And in fact, it gets better SEO quite often than your actual website itself. So at my clinic, Restoration Health Clinic, we've actually chosen, instead of the bio section, we've added an inspirational quote so that patients can align with our missions, our individual missions. And we love that approach. So you can use this section in a really unique way for however works for you and your practice. But use this feature because it's really useful to highlight something really special about you, and it will really catch your patient's attention. So one question we had from our community, I'm going to just pause here and go to that. They asked us, what's the best way to communicate between multiple admin? And excuse me, communication is a really big question we often get at Ginger Desk. And I thought, I'm going to throw it in here in staff profiles because for those of us with multiple practitioners, with multiple team members doing admin, getting the communication done right is really, really important, and it can make or break a patient's experience. So the question was, what's the best way to communicate between multiple admin? And what we recommend at Ginger Desk is that you create separate admin accounts for each of your admin and then use Jane tasking wherever possible. So Jane has some amazing guides online. If you don't know what Jane tasking is now, please go in and check it out. It's how we recommend everybody communicates and tasks each other in the admin department. And it really is best practice because it keeps communication HIPAA and PIPEDA compliant. It's attached to the patient's chart, and then it allows each admin staff to see the status of tasks, and then they can pick up and help out however needed. So we also suggest using starred notes on profiles to ensure that everyone has access to critical data. So that's another hot tip for you. Oh, and here it is. Here's what the staff profile looks like. You can see the settings, the treatments, and you can see the permissions up there, and tasks are on there as well. Now, treatments and services. This might sound really simple, but I wanted to mention this today because we see so many people getting this wrong. Using disciplines to create categories in your online booking is the best practice. So if you don't use disciplines to create categories, you're going to end up with this really long list of consults. And when you get a new patient going to your Jane booking link, it's going to look totally overwhelming. It doesn't look professional, and it's just not the right way to do it. So if you're new to Jane, you're lucky because you can get this done right from the start, and then it really helps for ease of reading from the patient's perspective. So another question from the community, we had someone ask, we're in the process of starting to transition to using Jane. What is the best way to support clients during this process? And I love this question because it comes back to communication again. And communicating this change, if you're switching EMRs or if you're going from paper to Jane, and suddenly now you have online booking available, communicate the change early and frequently. So I would suggest a minimum of 6 weeks notice as best practice. Oh, did I freeze for everybody? Oh, good. I'm back. Great. Super. I'll just go back to that. One moment. I'm going to go back to my question here. Thanks for your patience, everyone. The internet is a wild ride. So what I recommend is that you let patients know that you're switching to Jane or that you're moving from your other EMR or going from paper charts really early. So give them 6 weeks notice. You can send out the welcome mass email from Jane, which is truly best practice. You can also then follow up with some MailChimp emails. So you might want to remind them rather weekly that you're switching to Jane so that they can get themselves set up appropriately and that their whole experience is wonderful. If you have a brick and mortar practice, you could also consider adding a sign up at the front desk, but you cannot communicate too early or too often on this stuff. And so I might even suggest you communicate 6 weeks early and then every week for 6 weeks. So let me know at the end if you have any other questions on that. Now, intake forms. So 95% of the clients that we work with here at Ginger Desk and we perform audits for, they have multiple intake forms. And when I say multiple, I don't just mean 3, I mean like 7 to 17. And then we also see folks with like 17 consent forms. And I want to speak to this really seriously today because our philosophy and our rule at Ginger Desk in the Ginger Systems department is this. It's to create one robust form. And not everybody's going to agree with me on this, but I'll tell you why. You might want to have a few different intake forms for patient populations. That's fair. You might have an adult and a pediatric, but truly, if you're working with, if you're a clinic owner like me and you're cross-referring to other practitioners within your clinic. So say you're a naturopathic doctor and your patient maybe goes to acupuncture, then they go to physio, maybe they get an IV. It is so much more seamless for your patient to already have the paperwork done. You've got the ability to share the intake form with those other disciplines. And so the patient doesn't get bogged down with filling out extra forms. So Jane sends a lot of emails and we know this. So creating one form increases the chance that the patient will complete all the necessary information. And it's really just so much more helpful for you. Now, in terms of consent forms, it's best to assume that all your patients are going to use all your services. So I suggest that you ask for consent to be treated for everything up front. So whether you do naturopathic, physio, acupuncture, Botox, IV, Chiro. If you have everything at your clinic, just assume that the patient's going to get everything. Get them to just click. There, they've consented to treat. It's so much easier. And the truth is, if you're a regulated professional, it's just doing your due diligence. You now know that you're covered and you're not chasing people down in case that they don't sign at some level. So I really, really highly suggest that one robust consent form for all treatment options in your clinic. So I'm going to pause again. I have a question from the Jane community that came in earlier. Recommended workflows for parents and a child client. And this happens a lot. We know as practitioners, parents and children often get confused. The parent will make the appointment and then for their child, but they've logged in as themselves and it comes up in Jane as the parent's name. So our suggestion to reduce confusion is to have two different profiles. So have two intake forms rather, one for adults and one for children. And then you can have a profile for each patient, the adult and the child, and you can link them as family members in Jane. And then you could also set up appointments with auto-populating consent forms that are tailored to children under 18 so that it's automatically attached to that visit for the patient. So they will get them really organized, all automated. Let me know again at the end if you need any more details on that. Okay, chart templates, phrases, and narrative tools. So many people are interested in this. And what I'm hearing in the community is that people feel overwhelmed with actually taking the time to set this up. And I will tell you, I know you want to do it and it is worth it. So we have seen people save 50% of their time charting just by having chart templates already organized. So a chart template is just simply a form and you create the headers yourself and you can add in all the verbiage that you typically repeat to patients ad nauseum. And it's so amazing. So for example, if you treat fertility, you can have all the prompts already there so that you barely have to add anything. You're just adding maybe some details in the O and some unique sections in the P. It's really, really incredible. And it's such a unique way for you to save so much of your charting time and get your evenings free. So here's a hot tip. We hear from folks that they want to use Jane phrases, but that they don't want to spend the time to actually take their document where they've saved their Jane phrases and upload it to Jane. So I talked to someone the other day, a practitioner just the other day, who told me they had a 96-page Google Doc with all the Jane phrases that they eventually want to upload into Jane. And here's the thing, there's an amazing feature called Save as a Phrase, and you can actually utilize it while you're charting. So I'm going to show you this tool because it's going to save you so much time and you're going to love me for it. So while you're in your chart note, you're typing, you highlight it, click Save as a Phrase. And now you've just put that into Jane and you're still with the patient and it didn't take you any extra time. So if you've got your Google Sheet of Jane phrases, that's awesome. And we should totally get that uploaded for you. But if you haven't yet started that document and you really want to get started on Jane phrases, just really be conscious every time you go into a consult. Do I always say this to patients? Because chances are 50% of what you say is repeated. So just go in there and save it as a phrase as you go. You'll be so grateful for the time saver. Now, memberships and packages. So my hot tip on this one is that not everyone uses packages, and that's because, and memberships too, and that's because there are some regulations around prepayment. So if you were looking to use this to collect prepayment for a whole bundle of your own appointments, and let's say you're a regulated professional here in British Columbia and you're a naturopathic doctor, you actually can't accept prepayment. So just note any regulatory limitations for yourself on that. Otherwise, packages are so amazing because you can sell a package of your naturopathic visit, nutrition, and maybe an IV. And then it's really simple to just add that in one payment for the patient. So it really creates ease of flow at the front desk. So here's a little look at what it looks like. It's really simple to create a package. and then just bundle them all together and send them over an invoice to the patient. Now, products and inventory management. We get asked all the time whether to use Jane for inventory or whether to keep inventory in an accounting software like QuickBooks or Xero. So I can honestly tell you now, having used all the things, that the answer is put your inventory in Jane. It will save you so much time and effort. If you want to save your admin staff's time and keep the experience frictionless for the patient, it's so much better to give them one invoice from Jane for the consult and the products they just purchased, all coming from Jane. When you use an external software, I'm picking on QuickBooks right now, but we all have an accounting software, and that's fine. We should all keep our accounting software, but we don't have to keep our inventory in it. Because when you go to give your patient an invoice for the products, whether it's physio products or health products you're selling, you need to then re-enter the patient information, their contact information, their demographics, into both Jane and QuickBooks. And it just causes, it's more room for error, and it takes double the time up at the front desk to create that invoice. So once you're in Jane, it's all there, it's way quicker, and it's less annoying for your front desk staff. So please do your team a favor and move your inventory into Jane. Jane makes inventory management so simple. So if you have large amounts of product, like I do in my clinic, we've got shelf after shelf of supplements, just like a store might. You can actually compile a spreadsheet and import it as an Excel spreadsheet or a CSV right into Jane. You just have to line up the columns, but you don't have to enter manually every single item. And that's a big misunderstanding that a lot of folks believe, that they have to re-enter all their inventory items. And I know if you have inventory, that's what's holding you back. But trust me, it's simple with a spreadsheet, and then you'll be so happy you did, because it's so nice to manage your inventory later. Now, in terms of reconciliation, so here's a question from the community. Workflow for inventory reconciliation. So great question, how to manage the inventory. So we suggest using order thresholds in Jane. So make sure you've got that dialed, and when setting up your product. So make sure you've got the threshold in there. And then you can use inventory reports really regularly to know when to order again. But I do still suggest doing regular inventory audits. Quarterly would be best practice. I know some clinics do yearly. I know some clinics do none, but it really is like the inventory management system is so good, and it is going to do its job. It's that we may have misentered products when we were unpacking the boxes, or somebody may have mistakenly, the owner might take a bottle off of the shelf and it may not be accounted for. So that's something to consider, is doing regular quarterly inventory audits. That's part of your workflow. Now, online booking and waitlist manager. So this is like having another employee in Jane. So we often get tasked with managing a waitlist here at Ginger Desk. And when we introduce this feature to clients, they're so surprised. And although it talks us out of a job, it makes the patient experience just so much better. So how this works is the waitlist manager scans your schedule, it looks for openings, and then it auto offers to anyone on your waitlist. And patients will find out about those openings quicker than if a human were to scan and send them an email. So the patients are so happy, they get into your schedule faster, and patient experience check. Now, question from the community. What are the best settings for waitlist management with the goal of filling spots the fastest? So my answer to this is that we suggest that you disable the waitlist holding time. Then the space is open to the public right away, in addition to the waitlist getting a notification about it. So that is our best practice, disable the waitlist holding time. Awesome. So now I have a couple fun memes here. So here's what it feels like to be a health practitioner with your manual waitlist. And here is you using, here's Jane Waitlist Manager stepping in. So you feel like you have a new front desk employee working for you. Now, Billing and Jane payments. There are so many benefits to using Jane payments, and because this comes up so frequently, I wanted to spend some time and speak to you directly about the benefits of why it's great. It's not just for virtual practice. It's Jane Payments is amazing for brick and mortar clinics as well. It's HIPAA and PIPEDA compliant, and it saves a ton of time and money. So you can charge the card on file when somebody dashes out of the clinic and they don't have time to talk to you. You can also charge the card on file when you have a no-show. You'll have far more accurate and less frequent accounts receivables. And best of all, you don't have to take info from outside Jane and enter it into Jane. It's all integrated. So it truly saves so much time. We have seen that front desk staff spend so much time on checking patients out that we can save 95% of that time by just moving them over to Jane Payments. So it's really something to consider. Oh, and here's another meme, good old Jake Gyllenhaal. When you can leave for vacation knowing your accounts receivable is all up to date. There it is. See you later. Go on vacation. And integrations. So integrations are amazing in Jane. If you haven't checked all of them out, make sure this is part of your admin health checkup. So for those of you in the States, you can look at Claim MD. For those of us in Canada, direct billing through TELUS Health is just absolutely incredible. Once your account is registered, it's so simple to use. And here we go. We have a question from the community. What's the recommended workflow for receiving insurance payments and making sure visits are paid by insurance? So we have two workflow options for you, too. First would be to run weekly, monthly accounts receivable reports, and you can see who hasn't yet paid. The second option would be to keep a tracker for your direct billing patients. So this might be in a CRM that you're using. You could also use Excel or Google Sheets. And then using the submitted status on claims and marking it as paid once the statement has arrived. So this ensures accuracy for your AR. Now, you also probably know already that MailChimp is integrated, but it is so helpful. It adds patients who have consented to receiving emails from your practice. So it's legit and it's really lovely. And then the other ones I just wanted to mention, did you know that Clinic Sites is integrated? So that's SEO, social media, and website, all integrated with Jane. PhysiTrack for physios, FullScript for those of us who prescribe supplements. So handy that the supplements are all integrated there. And then I wanted to talk about the Google Analytics feature and give you a tiny hot tip on this. So that's connected to Google My Business account. And I wanted to let you know that it's HIPAA compliant. And so it will stop tracking a patient as soon as they become a patient. So they'll be monitoring things on Google until that patient is actually booked with you in Jane because it's HIPAA compliant. So next topic, how can Ginger Desk help? Well, in so many ways. And first of all, I want to say a big shout out to Jane. I'm so excited to officially announce our partnership with Jane. So Ginger Desk and Jane work so well together, and now we can officially shout from the rooftops that we have a partnership with Jane, and together we aspire to help so many health practitioners find admin freedom. So as I told you, we help with new account setups, optimizations, including admin health checkups. We build out playbooks and office manuals, and we also help with the day-to-day, like communication, billing, and more. Anything your front desk does, Ginger Desk can do remotely. So take-home messages today, it is worth taking the time to upgrade your admin workflows and your systems. Your practice is worth it. Admin health checkups save you time, money, and they improve the patient experience. Jane becomes another staff member for you, so it's worth it to get all those automations working for you. And Ginger Desk is here to help upgrade your admin department. Thank you.
Amazing. That was so great, Dr. Julie. Thank you so much. I don't know if you had much of a chance to keep an eye on the chat, but that was popping off. There were so many questions. Lots of great
Awesome.
questions about Jane, lots of great questions about Ginger Desk. So it was so amazing. So I think we're getting pretty close to time. So anyone that has to pop off, please do. And this, like we said, this is all being recorded. You'll get the recording later today. It will be up on our YouTube. So don't worry, you're not going to miss anything. But we know your time is precious. We know you have to get back to clients and patients and work. So if you have to leave now, that's totally fine. We will send you the recording later. But we did want to go through a few questions from the Q&A. So I have a
Great.
couple noted down that I wanted to touch on. So let me just take a look at my notes. One was, does Ginger Desk do social media admin?
We do not. That's the one thing we don't do. But as I understand it, Clinic Sites does.
Exactly. So I was just going to say, it was mentioned earlier, and I think someone had a question about they missed the name. And so there is also a company that is integrated with Jane called Clinic Sites. Someone from the Jane team can pop a link in there. They do both social media admin, websites that are connected to your Jane account. There's a really amazing two-way sync. We'll go into too much detail about it. Take a look at the link that's posted there. And there is a great video on our YouTube as well about that. But that's great for SEO, websites, social media. That's all those types of things. Someone was wondering if you could give a little more details about like the US clients you work with, because I think we've got quite a few members from our US community here today. So maybe
Great.
just a bit more details. I know you said you'd work with people across the states, so maybe just a little bit more detail about the types of disciplines and just what that looks like. Because obviously you started in Canada and what that looks like
Yes.
working with your US customers.
So we started in Canada, but then we very quickly, 6 months after we started, we launched into the US. And in fact, the US makes up most of the clients that we support. So we are really well equipped to support all practitioners in the US. We support dozens of disciplines. So I won't list them off, but literally dozens of disciplines all across the US. So we'd love to hear from you. hello@gingerdesk.com, and you can ask us about your specific discipline.
Perfect. And then this might make sense to you. I think it was during potentially when you were talking about intake forms and someone asked if you could elaborate on using disciplines to create categories. They didn't fully understood what you meant by that.
Okay, so what I meant was that if you've got a number of different disciplines in your clinic, so I'm going to use my clinic as an example, naturopathic doctors, um, let's say acupuncturist, nutritionist, rather than have everybody's initial consults, everybody's return consults in a long list, group them together in terms of service providers by discipline. So naturopathic medicine for us is one category, and then you'll see all the practitioners within that category who do that. We also chose to create a discipline called IV therapy so that we made it really easy. So I like to think of it as like the services you're providing within your practice, create those, make those the categories rather than having just a really long list that people have to scroll through.
Perfect. And I think the last one we'll get to, I think I saw quite a few questions around intake forms. So I'm going to kind of lump them together. Hopefully you'll be able to answer this. So there was one about the idea of making this universal intake form. And so how do you make one a universal intake form while also capturing different rates for different services? But then also, what about when some practitioners are associates and require supervisor sign off, and then also informed consent? So there's lots of questions around how having this one universal intake form can sort of interact with these different scenarios.
Let me just piece that apart. So, I mean, one intake form, we do that at my clinic. Well, that's not true. We have two. One intake form for adults and one for peds because they're just the children just there are completely different questions. We're typically not asking about menstruation and certain other details. Um, so I would say it doesn't necessarily matter if you've got a supervisor signing off. The intake form is the patient's information that will appear in the chart. So I don't know exactly how the supervisor relates to that part. But the intake form just makes it easier for the patient to fill out one thing and then go see different people. And then what was the other piece to that, Dustin?
So there was the part about capturing different rates for different services, the
Oh,
part
different
about
rates.
yeah.
Yeah, so I just wouldn't have my rates in the intake form at all. And so you can have different rates for different practitioners and still attach the same intake form to their consults.
Mhm.
That answer?
Yeah, I think that's great. And I
Okay.
think the last one we'll end with because we're getting close to time. But there was a great question I think we see come up time and again. And so I feel like your team probably has a good like handle on this is When you use Jane payments and make the credit card on file mandatory, how do patients and view this? Because there are lots of people that are reticent around doing that. So how does your team approach that, and how do you see people like adopting that sort of credit card on file idea?
That's a great question. And we hear the hesitancy from the hesitation from our practitioners as well. And I would say don't make it mandatory on the first visit, but let them know that it's mandatory for every visit thereafter. And you can explain to them that for ease of billing, this is our requirement. As long as you make it a policy and not an option, I find patients totally understand. And it's really simple. Most businesses nowadays, like if you think of a hotel, they make credit cards required even for the first visit. So I think just making it mandatory for follow-ups is best practice, and it's really common these days.
Mhm. And I see Catherine just added a little bit more explanation to what she was asking around informed consent. And so what she said was some disciplines require rates to be clearly stated on the intake form as part of informed consent. So there are just certain disciplines where, unfortunately, I guess that universal intake form idea can't work.
Or you could still add it. I mean, it's just going to be a really long
Mhm.
form, and you could just add it as a disclaimer at the end, right? For those of you coming to see Catherine, here are the rates. For those of you coming to see Michael, here are the rates. I think it's possible, and it's just it makes admin so much easier.
So, with that, I think we'll wrap it up here. Have a great rest of your week, and we will hopefully see you for another session soon. Thank you, everyone, so much. Take care. Thank you, Dr. Julie. Thank you, Jane team. We'll see everyone again soon.